My name is Jim Gardner. I'm the Trust Medical Director. The purpose of this video really is to just remind everyone about our particular efforts to help patients who are being discharged into our own community services and the things that we might be able to do to help that and, if possible, to bring any discharges forward so we minimise length of stay for patients. You know, before Christmas we had our Ho Ho Home for Christmas initiative, and in fact it was very successful in facilitating discharges, and we really want to keep that going now. So I'm going to read some things out because there's quite a bit of detail in this and I want to make sure I've captured it, but we will also provide a link to the detail so that you've got the detail refreshed when you need it. So under a kind of heading of why not home, why not today, we've got this simple checklist which we can use to support discharge to our community services. So the first is around deltaparin, so injectable anticoagulation and so forth. Can we enable patients and their families to administer it themselves, and can we make sure that first doses are given before discharge? Second is around basic care, for example around catheters, how to connect catheters properly, how to change to night bags and so forth, so giving patients and their families the skills to do that. Third is a similar one really around administration of insulin and making sure that patients at discharge know how to do that, or that they've got family members who can help them. Similarly with eye drops, making sure that patients, family and friends know how to administer eye drops if relevant. If a patient's going home with a syringe driver, that the syringe driver is fully charged at the point of discharge so that gives more time for the community team. If patients need dressings and other supplies, that they're given 5 days of supply at discharge, again to give some time for the community services to catch up. And some contact numbers, so prior to discharge and referring particularly at bank holidays and weekends, to make sure if there are any tasks they're updated to the community teams. For the Fylde and Wyre teams, they're available via our switchboard, and for the Blackpool team there's a single point of access. The number is 955505. So we hope that checklist is helpful, and that the references are there. Absolutely mission critical that we minimise length of stay for patients. We know that long stays in hospital are themselves a cause of poor outcomes, so it's really in the patient's interest for us to minimise length of stay, and these are some things to help. Thank you as ever.